Pullman Regional Hospital is committed to being transparent in providing information to patients and families, including the cost of providing care. The cost of providing care in a hospital has unique challenges in today's environment of healthcare reform. This short video is designed to explain where your healthcare dollar goes and the importance of Pullman Regional Hospital having additional sources of revenue as a pathway to create a self-sustaining, self-determining healthcare system for the region. Pullman Regional Hospital's endowment for quality and access is a critical pathway that we are partnering with our community to support. Ever wonder where your healthcare dollar goes? Oftentimes, people are shocked by the bills they receive from the hospital, and they should be. It's expensive to be in the hospital. But when you break it all down, you see that there's only a small part of that bill that is left over. For example, if we charge $1 for a Tylenol pill, or a Band-Aid, or a trip to the emergency room, 40% of that dollar, right off the top, is excluded because of the contracts that we have with Medicare, Medicaid, and insurance companies. The government tells us what it will pay and what it won't, so that all comes out to about a 40% reduction off that dollar. Now, let's see an example of this using a situation most of us have been in, buying a TV. Customers Mary, Bill, Jennifer, and George all go to Acme Appliance to buy a TV. The TV is priced at $200. The price of the TV reflects the cost of buying the TV from the wholesaler, overhead of the store, and a reasonable profit margin for the business. Mary, Bill, Jennifer, and George all pay $200 each for a TV. So the manager of Acme needs to make $800 and does so by charging $200 each for 4 televisions. In healthcare, the hospital has 4 customers who each need an X-ray. Even though the actual cost of each X-ray is $200, the hospital needs to charge more than $200 each to end up with $800, like the Acme Appliance store did. Here's why. In a hospital setting, patients, Mary, Bill, Jennifer, and George, all go to the hospital for an X-ray. The actual cost of the X-ray is $200. This amount reflects the cost of X-ray equipment, supplies, other overhead, and a reasonable profit for reinvestment in the hospital. However, the hospital actually charges $302 for the X-ray, which reflects the cost of the X-ray equipment, supplies, other overhead, a reasonable profit for reinvestment in the hospital, and sufficient room to absorb the payment discounts from government and insurance companies. Here's how the discounted payments from government and insurance companies work in healthcare. Mary's health insurance is Medicaid. Bill's is Medicare. Jennifer has private insurance, and George is self-insured. Under this scenario, government and insurance companies negotiate with hospitals to pay only a percentage of what is charged for the X-ray. Medicaid may only pay 35% of the charge. So 35% of the $302 charge of the X-ray is $105.70. That leaves $94.30 that the hospital does not get reimbursed for on the original $200 cost of the X-ray. Bill is covered by Medicare. Medicare covers 50% of the $302 charge of the X-ray, or $151. This leaves $49 that the hospital does not receive in reimbursement for the actual original cost of the service. Jennifer has private insurance, for example, Blue Cross or Aetna. Private insurance covers 80% of the price, or $241.60. This leaves a profit for the hospital on the original $200 cost of $41.60. Finally, George has no private insurance or coverage by a government program. He pays for the full charge of $302. At the adjusted charge of the X-ray, the hospital has a profit of $102. Pullman Regional Hospital has approximately 40% of its patients covered by Medicaid or Medicare. Again, approximately 40% of the price the hospital charges is written off through these discounts government and private insurance companies insist upon. Combine this with increasing charity care the hospital must provide, costs of personnel and supplies, and it becomes clear that many independent hospitals are not in a financially sustainable position. So now back to the beginning, where a 40% reduction comes off that dollar to start. We've now got about 60 cents that we're working with, and there's another 2 to 3% that is for charity care, uncollectible accounts, bad debt, etc. So now we're working with 57 to 58 cents on that dollar. And then you've got about another 75% of that for salaries and benefits. So of that 57 to 58 cents, you've got around 40 to 45 cents of it paying for staff, which are the key to having a quality, meaningful experience in a hospital. High-quality, satisfied staff that feel they have the resources to care for patients in a safe and effective manner. So now we're left with only 10 to 15 cents to pay for supplies, utilities, and to pay for whatever debt that we may have from capital equipment, such as new MRIs, new CT scanners, and advancing technology for robotic surgery, as well as a few other small categories of cost, professional fees, legal fees, and some specialists that come to the hospital that provide services that we contract with. So at the end of the day, the average hospital, and Pullman Regional Hospital falls into this category, has about 2 to 3% of that dollar left over. That 2 to 3% is what helps fund the future. It's what we put aside to help pay for equipment, upgrade facilities, and expand into new areas. 5 or 6 years ago, Pullman Regional Hospital was typically seeing 5, 6, or 7% margins, and now even that 2 to 3% is declining, and it will continue to decline as the face of healthcare financing changes in America. That's why Pullman Regional Hospital is proactively creating the future of healthcare by partnering with our community to support a vision to create a self-sustaining, self-determining healthcare system for the region through support of the Endowment for Quality and Access. Join us today.